Well, good morning. Morning, yeah, great crowd. Thank you all for being here today. We want to welcome the governor, first and foremost. Thank you, Governor Stitt, for being with us today as we kick off the legacy grants. And I want to recognize our board members that are here today. We have Aaron Harmon, Marshall Snipes, Jack Allen, and we also have the Health Commissioner, Keith Reed. Thank you all for coming. And we also have all of our legacy grant organizations from across the state. So thank you all for being here today. Thank you to you for your commitment to a bold vision for a healthier Oklahoma. And thank you for your commitment to health. And now I would like to introduce Governor Stitt.
Thank you. Let's see here. There we go. Well, good morning, everybody. I'm so sorry to keep you waiting. Hope it wasn't too long. I've got a great excuse. My commute was a long way from the governor's mansion. I'm joking. I was up north. I was up at the border. But anyway, it's a little chilly this morning. Everybody dressed warm. It was cold outside, but anyway, and also my staff was telling to have the Olympics here in 2028. That's a huge deal. And first off, I just want a big thank you to Executive Director Julie Bisbee for inviting me here today. And so for all the healthcare leaders, the media, and especially and in the country. Geography hits Oklahoma really hard. We have folks in small towns that drive 20, 30, sometimes 50 take for granted here in some of the metro areas. And if you're talking about specialty care, it's definitely hours away. So rural, some higher chronic diseases, tougher maternal, infant health issues, more behavioral health needs. So one way we're tackling rural health care is this $223 million grant that we got from the Trump administration. And we have great relationships with our federal partners, and whether it's the Biden administration or the Trump administration, I tell all of my cabinet secretaries, it doesn't matter, we have to develop great relationships as Oklahomans. And I was really proud. We had the fifth most funding in that grant. We were the fifth highest, I guess, state in the recipient money granted to our state. And that's just because behind the scenes, the relationship about that. The relationship with RFK Jr. doesn't hurt either. Did y'all see that when he came to Oklahoma, I took him out to my garden, and we actually did some gardening together, which is really fun, having a Kennedy at my house, which my mom thought was really crazy. It's all those relationships matter, and I just can't tell you how proud I am of my team and the relationships they've built. But we will have better access, workforce support, data connections, and stabilizing some of those rural facilities. And it's going to set up rural Oklahoma and our kids for a great future and some real healthcare wins. But anyway, that momentum rolls right into these awards today. 25 years ago, Oklahoma voters created TSET to protect our tobacco settlement money and keep it from being spent irresponsibly. And today that funding is benefiting 14 projects across rural and urban Oklahoma. So it's happening from research to workforce prevention to access. So that's going to be $150 million that they're going to add to these other grants, and it's going to be a game changer. And that was the first year, by the way. I think those grants from the Trump administration are going to go on for 5 years. But we're talking cancer clinical trials in Tulsa, nursing education in Ada, food security for our students. Something's happening literally in every corner of the state thanks to TSET. So TSET says they're committed to public reporting every step of the way, and we're going to track their progress together because this money belongs to the people of Oklahoma. And I'm so happy that they're investing it this way. So this is Oklahoma investing responsibly, strategically, and with a clear eye on the future we're building together. So with that, thank you guys for everything that you do for Oklahoma on behalf of 4 million Oklahomans. We really appreciate your industry. I tell people all the time that let Washington, D.C. play politics. The 4 things that we always focus on as Oklahomans that we can all agree on is we want the best education for our kids, we want the best infrastructure, we want the best health care system, and then we want the best economy. And so those are the things I always focus on as your governor. So I'll invite Julie back up, and thank you so much. God bless you, and let's keep making Oklahoma top 10.
Thank you, Governor Stitt. And it's a bold vision that is results-oriented. We're here at a truly historic time, celebrating the 25th anniversary and thanking Oklahoma voters who, in 2000, made a bold choice that no other state made. They constitutionally protected an endowment fueled by dollars from a tobacco settlement, and we're using the earnings to improve health, to bring residents across the state. So we're doing things right here in Oklahoma. The focus that we have with our legacy grants is on durable capacity. Facilities, workforce, systems change that improve outcomes over time and help Oklahomans live healthier lives. We talk about being a rural state. We know that health is not just Oklahoma City and Tulsa, but those fingers move out across the state. It takes partnerships. That's why we are a strong contender when there are federal opportunities. We've done this before, and it shows. These historic awards are also going to move us forward. We anticipate big results, guys, no pressure, right? We also, as TSET, are celebrating the ability to make larger grants as the endowment. I remember in the early years, we didn't have these types of dollars. The endowment was growing. There was fiscal discipline and focused very strategically on tobacco. And we've seen great strides in that. We moved that vision into obesity. We're seeing marked improvement in that. And that is fantastic. That is something a lot of other rural and southern states can't claim. We are top 10, number 1. Users in need of treatment with the Oklahoma Tobacco Helpline. We have a track record of proven success, and we're glad that you are a part of this. So today, I'd like for you to hear about some of these partnerships. You need to hear firsthand about the impact of these grant dollars. So first, I'd like for you to hear about our partnership with OU Health Science Center and OU Health Stevenson Cancer Center in Tulsa. TSET's $25 million grant partners with other funds that will help increase access to cutting-edge treatment across the state. We have the data. We know who is coming, who is getting screened, and who is succumbing to cancer. It's important to make that statewide network and support our National Cancer Institute. I have Dr. Gary Raskob today. He's the Senior Vice President and Provost for the University of Oklahoma Health Campus and its programs across the state. Dr. Raskob holds academics appointments in the College of Public Health, the College of Medicine, and is a regent in medicine. He began his career at OU in 1991, and he serves as the Senior Vice President and Provost for the campus. Welcome, Dr. Raskob.
Good morning. Thank you, Julie, for that kind introduction. Thank you, Governor. It's an honor to join you, our partners here at the Tobacco Settlement Endowment Trust, and fellow legacy grant recipients as we come together in an extraordinary milestone for our state. For the University of Oklahoma, this moment is deeply meaningful. At OU, our purpose is simply to change lives. Nowhere is that purpose more evident than in our role as the state's fully integrated, research-driven academic health system, where patient care, education, and research come together to address our most urgent health challenges. In Oklahoma, few challenges are more urgent than cancer. Oklahoma has the 4th worst cancer mortality in the nation. 1 in 2 men and 1 in 3 women in Oklahoma will be diagnosed with cancer in their lifetime. Each year, 24,000 Oklahomans are diagnosed with cancer, roughly 66 people every single day. And despite remarkable advances in cancer treatment over the past decade, still 30% of those diagnosed with cancer will die from this diagnosis. That reality and why TSET's investment is so impactful. In 2001, the Oklahoma State Legislature passed visionary legislation which directs now research program in Oklahoma City and in Tulsa. This program should provide statewide leadership in cancer research, prevention, and treatment, and gain national recognition for excellence in the fight against cancer. National Cancer Institute. And while OU knew we could lead this, we also knew that partnership was essential to achieve this goal. Partnership with our state government, partnership with private philanthropy, and with TSET. TSET has long been a cornerstone partner in Oklahoma's fight against cancer and improving health and longevity. Since 2012, TSET has funded the Phase 1 clinical trials program at the Stevenson Cancer Center here in Oklahoma City, bringing first-in-human and early-phase therapies to Oklahomans who often have no other treatment options. These trials are not abstract ivory tower research. They are patient care, opportunity, and for many patients, their hope for survival. In northeastern Oklahoma, cancer mortality rates remain among the highest in the state, and access to advanced treatment and clinical trials has historically been limited. Our data shows that less than 5% of the patients enrolled in the clinical trials at the Stevenson Cancer Center are from Tulsa or Northeast Oklahoma. This $25 million legacy grant will extend those same opportunities to Tulsa and Northeast Oklahoma, ensuring that geography is no longer a barrier to participating in life-saving clinical trials and cancer care. TSET has also awarded grants that have helped recruit top cancer research scientists to the university and helped leverage additional funding, particularly federal funding, in tobacco prevention, cessation research, and screening. Through initiatives like the Lung Cancer Screening Bus, TSET has helped bring early detection directly into communities across Oklahoma, particularly rural and underserved areas where lung cancer screening rates have historically been among the lowest in the nation. Over time, TSET's cumulative investment in the OU Health Stevenson Cancer Center now totals more than $200 million. Let's give a round of appreciation. These investments have supported a continuum of research and care that spans detection, early detection, prevention, research, and treatment. This legacy grant is not a departure from the continuation and acceleration of this deeply rooted partnership so that we can have profound impact on changing the outcomes in Oklahoma. All of this work is anchored by the Stevenson Cancer Center's unique role in our state. It is the only National Cancer Institute designated cancer center, placing it amongst the top 2% of cancer centers in the country. The National Cancer Institute designation brings a level of research-driven cancer care found nowhere else in Oklahoma, including the only Phase 1 clinical trials program where new therapies are offered for the very first time. And here's why the NCI designation really matters. Studies have shown that patients treated at an NCI-designated cancer center experience up to a 25% greater survival rate during the first year after their diagnosis. A truly life-saving difference driven by access to multidisciplinary expertise and advanced clinical trials. But that only matters if the patients can reach it. And so the construction of the new OU Health Stevenson Cancer Facility in Tulsa, and by state government and philanthropy, will bring access to NCI-level cancer care at home for patients in Tulsa and throughout Northeast Oklahoma when this center opens in the spring of 2028. This legacy grant will help build out a specialized floor designated to clinical trials, including an investigational drug pharmacy and a pharmacokinetics laboratory, capabilities that define top-tier NCI cancer centers, top 10 NCI cancer centers, and support bringing promising therapies to patients sooner. Today, the Stevenson Cancer Center conducts over 500 clinical trials, giving patients access to these innovative treatments years before they become widely available. And our goal in Tulsa is to provide services fully on par with the Stevenson Cancer Center in Oklahoma City. This is not a little satellite expansion. This is a full-fledged facility that will provide the range of services that patients can get here in Oklahoma City, including all these phases of clinical trials, so that patients across northeastern Oklahoma have the same opportunities for cutting-edge life-saving care. This investment by TSET also strengthens our capacity to keep patients, providers, and research activity in state, reinforcing our health system and supporting families, workforce stability, and community care. This is a direct expression of our strategic plan at OU to lift the health of Oklahoma. We have really key goals for this over the next 5 years, and these are bold goals, and Governor, these are measurable goals. Our goal is to reduce cancer, hundreds of premature deaths each year, doubling the number of clinical trials, and expanding outreach to community across Oklahoma to make sure that every Oklahoman has access to research-driven, high-quality care, because we feel that a person's health should never be determined by the zip code where you live, and Oklahomans should not have to leave the state to receive the best-in-class cancer care and treatment that they deserve. These goals are ambitious by design, but they're measurable and achievable. Now, these goals alone won't change the outcomes. Partnership does. And it's the partnership that we've had because our state leaders in the legislature supported long-term health investments, because philanthropic partners like Peggy and Charlie Stevenson and many others stepped forward, and because TSET continues to do exactly what it was designed to do, make thoughtful strategic investments in Oklahoma's future health. Together, these partnerships are turning strategy into better health outcomes. So on behalf of the University of Oklahoma, I want to express our profound gratitude to TSET's leadership, to the board, and to the staff for their vision and stewardship and for the support of this award. We also appreciate, Governor, your focus on measurable outcomes and TSET's disciplined stewardship. We are ready to deliver these results as implementation begins this year. Years from now, when more cancers are caught early, when more patients have access to clinical trials, and when more Oklahomans can receive world-class care right here at home in Oklahoma, this moment will stand out as a defining chapter in transforming Oklahoma's health. Thank you very much.
Thank you, Dr. Raskob. Improving health is a statewide effort. We have our state partners here today. We have our state leadership. It will truly take all of us to get those measurable results. And, you know, part of those partnerships also include growing our own medical professional workforce, ensuring that our systems can train the doctors that we need in all corners of the state. TSET has awarded a $30 million grant to Oklahoma State University Medical Center, development of a training facility, and increased slots for medical students to get required residency training. That happens statewide. We have folks here from Durant who are doing a similar thing in another corner of the state. Fall in love or stay where they grew up and care for people that they have grown up with. We know that makes a difference. Today we have Dr. Mike Herndon. He's a member of the OSU Medical Authority and Trust to tell us more about this partnership. Dr. Herndon is Governor Stitt's appointee to the board and has more than 20 years of private practice as a family physician. But he doesn't just talk the talk, he walks the walk. He is a founder of 2 free community health clinics, the Hope Center in Edmond and the Lighthouse Medical Center in Oklahoma City. He's also previously served as the Chief Medical Officer for the Healthcare Authority. Dr. Herndon.
Thank you, Julie, very much. Well, in all sincerity, I really cannot think of a better fit for these TSET Legacy Awards than OSU Medical Center. Honestly, it fits our mission to a T. Our mission is not only to provide first-class care to those who are treated in our hospital, but to train the next generation of providers, not just physicians, but pharmacists and allied healthcare professionals as well. 10 months ago, OSU Medical Center began work on a 180,000 square foot expansion. It has 8 new ORs, and these ORs are not just standard operating rooms. These ORs will be equipped to conduct broadcast sessions for learning and education for remote learners and surgeons who want to learn how to do new techniques. It will have a research lab. It'll have a patient sky bridge that will connect to the Jim Inhofe VA Center across the streets. And it will be next door to a new behavioral health facility as well, creating a real hub for healthcare just west of downtown Tulsa. OSU's mission and current expansion and growth efforts are happening right now. We began, and we're in the middle of it, and we could not be any more aligned with TSET, Legacy Grants, and Governor Stitt's mission to accomplish top 10 status in healthcare outcomes. The aim of these TSET Legacy Grants is to create infrastructure that will provide sustained healthcare systems, sustained healthcare access, and improve outcomes across not just urban and the meccas of Oklahoma, but into the rural communities as well. This grant will allow us to put more providers in healthcare workforce. It will, our goal actually is to create 100 more medical residency slots over the next 10 years, a goal that is definitely achievable. The average OSU trained physician cares for approximately 2,500. So if our goal, which we have determined to be 177 graduating physicians trained and added to the healthcare workforce, creating the ability to provide right at 450 to 500,000 Oklahomans getting care. Now, it is one thing to provide care. It's one thing to have access, but it's another thing to have quality access, and to have access that is relatable, and to have access that is available and not having to drive, as Dr. Roscoff said and Dr. Stitt said, a long way to achieve it. Oklahomans deserve not only the ability to see a healthcare provider, but they deserve a well-trained provider, and they deserve a provider that is convenient and close to them and do it in a timely manner. So this grant, again, helps us to provide that very access and that ability long-term. The governor's mentioned access, but also mentioned prevention as a step towards improvement. Disease prevention is really where the improvements are. Disease treatment is not. Truly, that is what leads to health outcomes, improvement, and cost savings. Prevention, not treatment. This cannot occur without an adequate number of medical providers who are well-trained and in numbers adequate to serve. So this requires more training slots and better learning resources like we are achieving to develop at OSU. So in my concluding remarks, I would like to share the OSU Medical Center Board's enthusiasm. We are enthused and we are excited and invigorated because this will allow us to deliver on our goals. As a lifelong Oklahoman, raised in a rural community, cared for by osteopathic physicians throughout my youth and teenage years, and even now as my primary care provider, I attended OSU Center for Health Sciences Medical School in Tulsa. That has received this $30 million grant. I practice family medicine full-time in both the rural eastern Oklahoma community, Sallisaw, Oklahoma, go Black Diamonds, 17 years. As Julie mentioned, I did serve as Chief Medical Officer for the Oklahoma Healthcare Authority and Medicaid for 6 years and got to partner with many of you in the audience who I've gotten to see, Keith and Jessica. But now I have the honor, privilege to serve on the board for the Oklahoma State Medical Authority and Trust. I just want you to know, Julie and Governor Stitt, that the board understands the needs. We understand the desires of the state. We're grateful and we're thankful for the leadership that you've given us and the opportunity to serve this great state of Oklahoma. We are sincerely thankful for the $30 million legacy grant, and our pledge is to see that it is used to deliver practical and community-based solutions. We will be laser-focused on the governor's top 10 vision and TSET's long-term approach to improve healthcare outcomes. Thank you.
Well said. Thank you, Dr. Herndon. Well, I would like to thank you all for coming today, thanking you for having a bold vision for Oklahoma, thanking you for your commitment to this work, to your friends and your neighbors. And we know also, as Dr. Herndon mentioned, health happens in a healthcare facility, but also in your community. So you're going to see those efforts continue from TSET, and I know some of that rural health transformation dollars as well. We as Oklahomans know what we need to do, and it is creating environments where the healthy choice can be active, where you can have fresh and nutritious foods, where you can have smoke-free environments. That's how we work together to bring these coming today. Thank you, Governor Stitt. Can we get a round of applause, please? Great things are coming for Oklahoma, and we're really at a moment in history here today where discipline, voters' wise choice, 25-year-old endowment is able to make these large commitments, and the leadership of the board making these wise choices. I will have to shout out to my team because I will say the legacy grants were a historic undertaking for any team, and we deliver and give you those progress reports and results as we go. Again, we will have media availability at the step and repeats for those of you that are interested in the back of the room. Thanks all.